and welcome to Health Solutions with Shawn and Janet Needham, where Team Needham discusses everything healthcare. I'm your host, Shawn Needham, along with my producer, Lindsay, and we are streaming live from the Moses Lake Professional Pharmacy Studio. And today we have Dr. Brad Brown on. He is from Strive Direct Health out in Colorado, and he is going to tell us his story of how he designed an EMR. If you don't know what an EMR is, you're going to learn today. It's electronic medical record, and it's one thing that really most physicians get very frustrated with. So his is one that's been designed by a doctor. You don't want to miss out. And what we're going to talk about first is that he is in a residency now, and he is choosing to go with direct primary care. We have talked about direct primary care on this show so many times, and he's going to discuss why he is choosing that route instead of going to the traditional healthcare system. So, Dr. Brown, welcome to our show.
Thank you. It's an honor. I've followed you peripherally, and you're like a celebrity. So
yeah, right. Well, thanks for that.
I got butterflies just now during that intro. I'm like, oh man, how am I going to live up to this? So thanks for having me. It's going to be fun.
You're welcome. You're welcome. So, thanks for the compliment, and I really appreciate it. So, tell us a little bit about you are a fairly new graduate. You're in residency now, and you are choosing to go into direct primary care instead of the traditional healthcare system. So that's quite a shocker. So for some, tell us why.
Well, medical school, it's a blast. It's a lot of studying. It's a lot of book times, a lot of time with patients, and just seeing. This is such a. I could go on for hours, so I'm going to try not to get on my soapbox. Listeners as well as you would fall asleep if I really got going. So, typically the direct primary care movement is somewhat new-ish, and docs and other healthcare providers switch to it after being in the fee-for-service model, the insurance-based model, because of burnout or for whatever reason. But I just wanted to nip it in the bud. I figured might as well go into it early. It seems like everyone loves it. And the more I looked into it, it just clicked with how I felt medicine should be, more time with your patients, whatever they need, time to advocate for your patients, and kind of sticking it to the system, if you will, sticking it to the man to try to find the best prices and be as transparent as possible. And I love seeing the look on patients' faces, and they're like, you can do that? And it's like, that's one of the reasons why I do it. It's fantastic. So in medical school, I figured, I wanted to be a family doc as it was, and I wanted to be the change I wanted to see in medicine. And I genuinely feel direct primary care is the way of the future, and that's just, I'm lifting where I stand, trying to do that little by little.
So give us an example. You say patients are surprised when you say you can do what? Give us an example of what you can do in a direct primary care role when there's no insurance involved. Versus in a traditional fee-for-service insurance system. Give us some examples of what you can do that you couldn't do in that system.
So generally speaking, you have, you go see your primary care provider, your primary care doc or PA or NP, and they, let's say you have low back pain. You tweaked your back 6 weeks ago or whatever, still hasn't healed. We've all tried to lift the fridge or do something like that, and it seems like you just tweak your back. So it lingers, you go through the normal thing of what you're asked to do. And then, 6 months later, it's still there. And in the insurance model, you have to check the boxes of try PT, you have to do the x-rays, you have to do the basic things before you can even get to an MRI. And then there's a huge copay. No one really knows exactly how much it costs.
Right.
But you're all of a sudden, 6-8 months down the line, we pride ourselves in America. Oh, we have so many MRI machines, we can get one whenever we want, when really we can't, through the insurance model. And so with direct primary care, it's like, I just call up the imaging center and say, hey, this is Dr. Brown. I have a patient, cash pay patient. What's the best price you have for them? They don't want to go through insurance at all. And usually these imaging centers, same with blood work, they say, yeah, cash is king. So let's get them in right away. Here it is. My clinical and professional judgment, which is always being fine-tuned, especially as a resident still learning, of this person genuinely needs an MRI. They don't need to wait 6 months. And so But I don't have to have the insurance company saying, nope, we're not going to cover that. Sorry. I can just call the imaging center and say, okay, for $250, here's an MRI with a read from a radiologist. And patients are like, absolutely, I'll pay $250. It would have been $500, $600, $700 out of pocket through insurance anyway. And so being able to just be a conduit, just be someone that can have the time in my day to advocate for patients with labs, with pharmacies, with imaging centers is fun. It's kind of a hobby, and I get paid to do my hobby, so can't complain about that.
That's awesome. And I think one thing that I noticed working with direct primary care doctors is that most of them, I'm going to say all of them are happy at what they do. And I will tell you, in the traditional healthcare model, most doctors don't like what they're doing. That's why they're either retired, they get out, change professions, or they go into direct primary care like you're doing. So kudos to you for staying in the medical field, because we want to keep good doctors, and being able to go into direct primary care and advocate for patients. So I heard one time somebody say, as a doctor, that actually, being transparent in pricing and knowing about pricing and advocating for your patients with prices is actually probably part of your oath. You could argue that if you are sending a patient to do expensive stuff that you can get cheaper, that you're violating the Hippocratic Oath, because you're not being financially responsible to that patient. Can you comment on that at all, Brad?
Yeah, the first line of the Hippocratic Oath is first do no harm, and I think you can easily add into that do no financial harm. That's a common phrase in the DPC world. I first heard it from Dr. Josh Umber himself, but he, that it clicks. It's like why we would never intentionally hurt a patient physically or emotionally or spiritually or mentally or whatever you want to call it. So why are we, every 6.5 minutes, why are we hurting each patient we see financially? And so yeah, it's fantastic. I love it. It truly is gratifying, and we've all felt burnout at some point in our life, and it's really easy to complain when we're burnt out, and it's hard to complain in this model just because it's so refreshing. It's like the old ice bucket challenge from a few years ago, where you just feel that ice cold water, like, oh my goodness, this actually works. So
Right. Well, and that's one thing that I appreciate about direct primary care doctors is that you hear so many doctors, and not just doctors, but you hear pharmacists, my colleagues, they complain all the time about the insurance system. And my wife and I got tired of hearing it. We just don't want to listen anymore. It's like, you don't have to be in that system. You can get out of that system. And in fact, you could argue that if you stay in the system, you're an accessory to the crime. So stop complaining, get out of it, and be a solution. And that's what we are here. We're Health Solutions with Shawn and Janet Needham. We talk about solutions. We don't just complain about it. That's what I love about direct primary care doctors like yourself. So kudos to you, Dr. Brown.
Well, thank you. Your analogy in your book about the grocery shopping was like, it just like opened my mind. I never thought of it that way before. I love analogies, but that was one I hadn't heard before. So the whole price transparency of just direct to consumer, it's the way it has to be.
Yes, and that's not an analogy. Is not original to me. I've heard that a couple other places. I was specifically referencing in my book a video from Dinesh D'Souza, who compared grocery shopping. What if grocery shopping was like healthcare? And basically, to just educate everybody about my book and what it says about that in that video. Basically, it talks about how you add a lot of things to you would put a lot of things in your cart that you didn't need because somebody else is paying the bill. And then at the very end, when you get out to pay, the grocery store owner realizes that the price does not matter because somebody else is paying. So they can raise the price to whatever they want. And that is exactly what's happened to healthcare. So thank you for bringing that up. My book is called Sickened, How the Government Ruined Healthcare and How to Fix It. It is available on Amazon Kindle version and also in paperback. So go to Amazon to check it out. Dr. Brown, you have a great story about in the traditional health fee-for-service system, you met a first-time mom.
Mhm.
and you were able to kind of transfer her over to direct primary care. Can you tell us a little bit about that?
Sure. So, um, first time of anything is a little nerve wracking. First time parenting is like, you can't believe they're letting you go home with a child from the hospital. It's kind of nerve wracking. I have 3 kids myself, and we were shocked each time that, we're not going to have nurses anymore to help us. Um,
Right.
and so I love meeting with and getting to know these first time parents. And I think it fits the whole direct primary care, for lack of a better term, fits so nicely with the younger generation. I will proudly say I am a millennial. Okay, I can't. I fit right in the smack dab in the middle of what Google says a millennial is. So I love being able to just give my cell number to a patient and say, text me if you need anything. And for
Yep.
first time moms, that's huge, because how many times as a first time parent are you like, I have no idea what, like, this, my kid coughed, like what's going on, or like they roll over for the first time, it's like, oh my goodness. And so this particular time was this first time mom. She had tons of questions in her first well child check, and I was like, you know what? Here's my personal cell number. If you need anything, just text me, because it's a lot easier. I know you communicate via text. I do too. And initially, she would text a lot, and that was fine. I love what I do, and it's totally fine with me. Some of my colleagues think I'm absolutely nuts for doing this, but I love it. So yeah, she, text pictures of a rash, or, is this food okay or that food okay? And it's, instead of her having to wait to schedule an appointment for 3 weeks from now, or to be able to message the pediatrician through a clunky patient portal, and then hear back 3 days later, it's just so much smoother and easier just to go direct to the provider. In this case, it's, myself. And she's been extremely grateful for that. Her child is healthy. I didn't have to do anything, and her child would be healthy, but her mind is a little bit more at ease that she has, a doctor at her fingertips. And it was an initial, flood of texts, but now it's more, they're spacing out as she realizes, I don't need to text about that. But that's the beauty of it. It's that initial help. It's that initial, just to be a soundboard. And another reason why I do it. It's just that people love it. People respect the difference in it.
Well, I think in the traditional system, it's pretty difficult to even, communicate with a physician. And probably the only way you can is, 5 minutes in front of their face if you get an appointment 3 weeks later. So direct primary care is just so personalized, and like you say, and not just millennials. I mean, Generation Xers and the like, and older, like that kind of communication. Because I know direct primary care doctors that take care of patients in their 70s, and to have that 24-hour access to a physician to them is just priceless.
Yeah, I agree. Yes, it is leveraging the technology we have for the benefit of people's health and mental wellness, especially in this day and age. This last 18 months or so is invaluable. Absolutely.
Yeah. And speaking of priceless, it is priceless, but tell us how affordable it is. I mean, how affordable is direct primary care in your practice?
So mine is right on par with typical DPCs around the country. Typically, it's age-based tiers. Younger kids, up to 18, we'll say, don't require as much, in-depth attention. They're generally healthy, and so a little bit less of a cost, anywhere from $20 to $40 a month. Yeah, just a monthly membership fee. Sorry, I apologize. I should have said that up front.
Yep.
And then, the middle, 19 to 40, 50-ish would be maybe $80 a month, $75 a month. And then older than that, because the older you get, typically your medication list gets a little longer. Unfortunately, I know I'm preaching to the choir here. We shouldn't have a long medication list, and might need a little bit more time and a little bit more mental focus on what that population needs. And so the price is a little bit higher as well. So I follow that general trend. We're just getting started. We're just starting the churn, if you will. because I still have my responsibilities here in residency as well for a little bit more time. So we're just trying to lay the groundwork for it. And it's fun. It's a blast.
Yeah, and it is very affordable. Even, I shouldn't say even, but $80 a month is just so inexpensive to have 24/7 access to a physician. So people don't realize that. And that's one of the reasons we have doctors like yourself on our podcast. They don't realize how affordable healthcare can be. You've already said it, but I'm just going to reiterate it. The things that make healthcare expensive is health insurance, period. That's what causes healthcare to be expensive. When you pay cash for healthcare and you shop around for prices, sure, you're not going to maybe go to your local big corporate clinic or your local big hospital, but when you can find and shop for most things on healthcare and get a very, very deep discount and better service and higher quality. Can you discuss about the service and quality, even though it's a low price? You want to discuss that, Dr. Brown?
Sure. I mean, I hesitate to say the word better on my end of things, just because there are some fantastic physicians in the fee-for-service model that do it. Higher quality, I mean, yeah, I pride myself in that, just because I feel like, me personally, it's very difficult in a 2.5-minute visit to cover what a patient wants. We have on our check-in list at the residency clinic, what are the 1.5 things you want to talk about today? And it's like, people, maybe this is the first time they've come in 6 years, and they have a lot of things they want to talk about. So higher quality, I would say it's even just a higher value. You're going to get, for that small nominal Netflix type fee, which is less than having a plumber come to your house, for goodness sakes. You have access to the doctor. It's like, hey, if you need 30 seconds with me, I have 30 seconds. If you need an hour with me, I have an hour. If you need to talk about all of this over here and you need a mole removed, let's do it. Whereas, you don't have the time or the bandwidth to do that in the fee-for-service model. The overhead's too high. The reimbursement doesn't work that way. You have to do separate visits. We're financially incentivized to bring people in on volume and to keep you as sick as possible. Unfortunately, that's the way it is. Insurance companies make it that way, to where we bill a higher level of service the more problems you have, and we bill we want to see you as often as possible. So follow up in a week. It's like, well, we could probably just follow up on the phone, but that isn't reimbursed. It is during COVID times, but that's going to change here shortly. So yes, it's extremely affordable, just to have access, convenient access for the first time mom, for the 25th time grandma, whatever you need. It's just text a quick question to your doctor.
Right.
Love it.
Right. That's cool. That's awesome. So let's move on to your EMR. EMR, why don't you explain to our listeners and viewers that don't know? I mean, some of them are medical people, but to those that don't know, talk about EMR and what you did to design an EMR that makes things better. So, and make sure that you focus on, doctors that use the computers in their room in front of their patients' faces to check all the boxes. And I'm assuming your EMR that's not what you're doing with your EMR. So go ahead and talk about EMR.
All right. History lesson. You ready? I love this. Obviously. So EMR is electronic medical records, or EHR, electronic health records, are nothing about medical or health, right? It's just it's a paper chart that's put on a screen, right? A lot of the big ones were created, 20, 30 years ago when computers just were born. There's a few newer ones now that kind of have lipstick on top of that. And they're clunky, they're hard to use. I like to say, I heard this from one of my friends, that these medical record systems are risk management cash registers, right? You check all the boxes so you don't get sued, and you check all the boxes to make sure you get paid as much as possible from the insurance companies, right?
Yeah.
With a little blurb about, hey, I saw Shawn for, he's, I don't know, whatever Shawn has going on. He's bench pressing too much or whatever. And he's worried that he can't afford enough weights. So a little blurb about what we talked about, and then all this other risk management stuff so we don't get sued, because it is defensive medicine nowadays. And then also to make sure we get reimbursed for the time. And you just churn through that. some family docs are seeing 30 patients in a day, which is mind blowing. And then, 60, 90 days later, you actually see the reimbursement come through from the insurance companies from that visit. So in direct primary care, you don't need all of that overhead. And so the systems that are out there kind of take away that billing aspect. You need more of a practice management platform, because a lot of DPC docs do everything on their own. They dispense a lot of medications out of their own office. They have the other inventory they need to manage. They do more of a membership billing to where they need something to auto bill patients instead of having to call them every month. Then you also need the record keeping and make it smooth and fun to use and work for you instead of against you. And so my brother, who's a software engineer at Amazon, a big wig, I use him for all my crazy ideas. And then he'll usually tell me, yeah, that's not worth it. And then my wife, she's a MBA, and she, for also my crazy ideas, she'll put the list of like, okay, this is what we need to do to attain that crazy idea. And then she lets me come to the conclusion on my own that, okay, yeah, that's a crazy idea. But this one actually has grown some legs. We're developing a full spectrum primary care, mainly direct primary care right now, but expanding into other areas soon, practice management suite. So one window, you have your medical record, you have your inventory, you have your billing, you have your communication with your patients, you have integration with labs, you have e-prescribing, because that's we have to have that nowadays, and a full cockpit to track everything as well on your dashboard. So the goal is to be a living, breathing tech organism that's not stagnant. A lot of things get a little bit stagnant when they're developed. They're hot and new and fresh right when they come out, and then the greatest the problem with success is nothing fails like success, if you will. So the minute you think you've made it, and then all of a sudden things go wrong. So we're trying to build for 2050, 2060, 2075, for the technology we're going to have there. And so we're just chugging along. We're in beta right now, and just trying to work out some kinks, because there are always kinks, even if you think there's not. So it's fun. It keeps me balanced. It keeps my wife on her toes, because I always come home with, hey, we should do this. And then it's like, okay, well, maybe not. And then my brother, he says, well, we got things more important to do. So it's fun.
That kind of sounds like my life at home. I have these great ideas, these big visions, and my wife's like, yeah, maybe not. Although usually she's right along board with me, but
yeah, they're our spouses have the more, not realistic, but they have the checklist. Like, okay, if we really want to do this, this is what it's going to take. Are you willing to put in that work? It's like, well, maybe, yes.
Right.
Yeah.
So is this the first EMR that is designed by a physician?
I would say no. I mean, there are some out there that are designed by physicians. They have a physician on staff and say what they need to have legally. But it's kind of a double-edged sword, and I'll let me explain before I get cut off the air. So design by a physician is great, because that's what we need. What do we have to make it to what doctors need? How do they think? Initially I gave my brother, this is what we need to have. And I said, just go paint a pretty picture and make it look fantastic, because you're the developer, be different. And then I realized that doctors, it's hard in the workflow to change that way. So we have to tweak it a little bit, but we don't want a paper chart on a screen. We want something that is dynamic and works for you, and is not just a bunch of tabs you go through and boxes you check. We want something that is completely different. And so designed by a physician, yes, but then we have the liberty with Kyle, my brother, to have someone in tech to design it the way that tech works. You think 5 years ago, even 10 years ago when the iPhone came out, it was like mind blowing. It was like, first of all, I'm not spending $700 on a phone, and here we are today, 10 phones later. But having that ability to say, yes, this is for the tech for tomorrow. This is not the tech from yesterday. And for the doctor's standpoint, hey, you have everything you need, and it's different, and you're going to love it. That's kind of what we're going for.
And so do we have any examples that we can show? Do you have a website we can show our listeners and viewers yet? Or
in terms of a landing page?
Yeah. No.
Yes. I might have to get back to you on that one. I think.
Okay. All right. We can include it in the show notes. We have a lot of healthcare, practitioners and DPC doctors that watch our show. So,
Cool.
they would probably be interested in your product. So, let us know if you have anything out. I know it's in beta testing. If you have some people that need beta testing or need some more beta testing sites, let me know too, and I can put out the
Definitely.
feelers. So,
Absolutely. Thank you.
yeah, you're welcome. So, what is the main thing that sets this EMR apart compared to traditional EMRs?
It's a loaded question too. You're hitting all the good questions. I would say that it's built for the technology of tomorrow. We're not trying to just make something that is good enough for now. One thing that really sets us apart is full spectrum suite, one window. You don't need to click into 7 different logins on 7 different websites to do all the different things. It's all right there. We're building in all of the machine learning that is all the rage right now in tech and fintech, and make it to where it can predict what you're going to do based on your habits. It's kind of like your iPhone nowadays. It knows what app you're going to open before you, just based on your location and time. So we're putting that into it, and so it knows that, hey, Dr. So and so is going to start charting. This is his basic template. It can just have everything preloaded right when you open it and things like that. So it really allows you to not be on your computer in front of patients, which is one of the beauties of direct primary care in general, not just this system, but also even take away that completely and then have it done.
And that was the question I was going to ask. Why should patients care about this EMR? So you kind of already answered that question, but if you want to elaborate on it, that would be good.
Yeah, I mean, we've all been on the patient side of things, and you walk in the room and the doctor immediately looks over here and starts typing. And it drives me nuts when I do it. I always apologize to patients now. I'm like, hey, I hate doing this in front of patients, but I have to look something up. But anytime you can have eye contact with a doctor or whoever the provider is in the room, anytime you can eliminate screen time after being with a patient, the AAFP has some research showing that, for every 1 minute with a patient, a family doc spends 3 minutes on the computer before and after. And so,
wow.
It's like, why are we doing that?
Yeah.
It's like, that's painful. And so, let's just eliminate the screen time as much as possible. There's still going to be screen time. It has to happen. Yep. But let's just minimize it as much as possible and let the computers do their thing.
So when do you get out of residency?
I get out in the summer of 2022. So end of June 2022.
So a little over a year.
Yeah, I don't have a countdown. I love it. I love what I do. This is just on the journey.
Yep.
But there are some big things that we have planned that can't quite start until then. So I do have a countdown for that.
Yep.
But
yeah, I love your attitude, Dr. Brown. So speaking of attitude, what drives you? What makes you tick?
You're a real Simon Sinek, aren't you? What's my why?
Yeah. It's not what we do, it's why we do it.
I know, right? So I played basketball through college. It got me through college. I thought I was going to the NBA, and then I started hanging out with the team docs too much and asking questions way above my education level. And they said, hey, maybe you should go to med school. I'm like, well, first of all, I don't love school, so I'm not going to go to med school ever. And then, now I'm here. Why I do it, I genuinely love trying to change. I love trying to change the healthcare system. I'm tired of all the news outlets and talking heads, griping and moaning. It's like, I'm just going to go do it, And I think it's fun. I know you can't really make a nationwide change unless you start where you're at. I love seeing the shock, the gratitude, the look on patients' faces, the emotion in their texts or calls of like, wow, that a doctor actually like stood up for me with the lab or the pharmacy or the imaging, or that doctor actually looked me in the eyes. There's tons of doctors that look people in the eyes. I'm not the only one. I'm not like bragging about that, but That's just kind of why it gets me up in the morning. You know, I love doing it. It's fun. It's a little bit different. Maybe I'm just one of the weird ones who likes to be different, but I truly enjoy it.
Yeah, it's obviously you have a passion for it. So, what's the best way people can get a hold of you? Don't you have a website?
I do. So it's strivedirecthealth.com. There's a contact page on there. There's my number, email, anything. It's pretty straightforward. Yeah. Oh, there it is. We're in Erie, Colorado. We're the only ones in the area that's doing direct primary care, but I'm more than happy to chat with anyone about anything. As you can tell, I do love to hear myself talk.
You're great for our show. Believe me, it
Yeah.
makes it easy to interview. So we
Yeah.
appreciate that.
Yeah. So that's the website. All the contact info is on there.
Great. Well, how would you like to sum up in a minute, our last minute here? How would you like to sum up our conversation today?
First of all, go buy your book because that was awesome. It just like brought everything together when I read it. And to just ask why. You know, I feel like you and I are of like mind of, hey, just ask why. How much does this cost? Why do I have to sit in the waiting room for 2 hours and then sit in the room for an hour before I even see my doctor? You know, there's got to be a better way. Seek out a better way. You know, that's kind of what we've been talking about without actually saying it. So
yeah, absolutely. And there is a better way, and you're doing the better way. There's no reason to have healthcare cost a lot of money. There's no reason to have to wait a long time for healthcare. Healthcare is very affordable. And, you know, one of my goals in this podcast is to educate and empower consumers that they are in charge of their own health, not an insurance company. Part of that is being proactive in their own health. And in chapter 6 in my book, I talk about a 6-step solution and on how to change the system. And consumers, you're in charge. And Dr. Brown, you're part of the solution too, because in step number 5, doctors have to get out of the system. Get out of the system and do something different like you're doing. So kudos to you for doing that and advocating for patients. So my book, Sickened, How the Government Ruined Healthcare and How to Fix It, on Amazon paperback and on Kindle version. Also, stay tuned because soon this week, I am coming out with a video. A lot of the stuff we've been talking about today about how healthcare is expensive is because of health insurance. I've got a great video on what if auto insurance worked like healthcare insurance. You will be blown away. It's a video with a lot of information in it and some satire and great analogies to the healthcare system. In fact, Dr. Brown has seen my video and gave me some great feedback. So stay tuned for that video. It should be coming out this week. And as always, thank you for listening to Health Solutions with Shawn and Janet Needham. Do not miss Thursday's show. We have Dr. Ken Fisher. He is going to be talking about the COVID pandemic and how it might have been fabricated by the United States government. You don't want to miss this, and hopefully we don't get censored on YouTube or Facebook for this one. It's some great information. He's written a book about it. He's written a lot of blogs about it. Very, very informational. So don't miss out. 8 a.m. Pacific Standard Time, Dr. Ken Fisher this Thursday. Thanks you for listening to Health Solutions with Shawn and Janet Needham.